Pulmonology is the study of lung diseases, ranging from things like asthma,
emphysema, or otherwise known as COPD,
interstitial lung diseases,
pneumonia,
and lung cancer.
So the low-dose CT scan is a new benefit for patients that is a screening platform that we use to identify patients with early-stage lung cancer.
So a lung nodule is a spot on the lungs that is not normal lung tissue. It can really run the gamut from something totally benign, which is the most common findings, to the most extreme cases, which are what most people think about, which is lung cancer. So the most common risk factor for lung cancer is smoking, but it's not the only one. And so there are a number of other risk factors, other occupational exposures, asbestos people know about, radon exposure, which is a common chemical released from our Earth's core. Cancerous lung nodules show up sometimes without any symptoms, which are what makes it tricky.
So a lung navigator is someone who guides patients through lung cancer screening, diagnosis, treatment, and care.
Lung navigator is very important in this process because, like I said, this is an anxiety-provoking situation, and so we want to be able to negotiate this process as streamlined, as expeditiously as possible. And so that lung nodule navigator is that point person.
We make sure they have a full understanding of their diagnosis. We answer all questions that they have. We make sure their treatments are done in a timely manner. And we also make sure that they have access to all the resources that they need, such as support groups and financial assistance. I want to make sure that they are supported and guided, and to let them know that I'm going to walk this journey with them right along beside them.
The whole reason we do screening CT scans for patients is that we want to identify lung cancer as early as we can because the treatment options are better.
So now that we're doing all these screening studies, we're finding cancers earlier. We've got the ability to use advanced techniques now that we can get to these nodules in all parts of the lung when they're at very small sizes in order to get a diagnosis early.